What are the key components to successfully training a deaf dog, and how do they differ from training a hearing dog? Answer: training a deaf dog requires specialized approaches due to their inability to respond to sound cues. The primary components are visual signals. Deaf dogs rely on sight rather than hearing. Trainers should use consistent hand signals for commands. Clear gestures are crucial for effective communication. Vibration cues. A vibration collar, not a shock collar, can be used to gain a dog's attention. It provides a gentle alert without causing distress. Body language. Dogs are highly sensitive to body language. Trainers need to be more conscious of their physical cues, making them clear and consistent. Positive reinforcement. Since deaf dogs can't hear a clicker, visual markers like a thumbs up or a flashlight blink should be used as rewards. Safety considerations. Deaf dogs may be more vulnerable to hazards like traffic. Strong recall commands and safe environments are essential. Consistent reinforcement is key to training a deaf dog, and avoiding punishment helps prevent confusion or fear-based behaviors. Discuss the importance of modifying training equipment and techniques for dogs with limited mobility, such as hip dysplasia or arthritis. Answer: when working with dogs with limited mobility, such as those with hip dysplasia or arthritis, training should be adapted to avoid pain and physical strain. Here are essential modifications. Use of supportive gear. A supportive harness can help maintain balance and alleviate stress on joints. This ensures mobility while minimizing discomfort. Low impact exercises. Training should focus on low impact activities like swimming or walking on soft surfaces to prevent further joint strain. Avoid exercises like jumping or running on hard surfaces. Frequent breaks. Dogs with arthritis or hip dysplasia tire more quickly. Sessions should be shorter with plenty of breaks to prevent overexertion. Pain management. Pain relief medications should be used in consultation with a veterinarian, as untreated pain can affect the dog's performance and willingness to participate in training. Gentle reinforcement. Trainers should use minimal physical manipulation, such as tugging or lifting, and rely more on verbal praise or treats. Outline the steps for creating an effective aggression management plan for a dog exhibiting fear-based aggression. Answer: fear-based aggression is common in dogs that feel threatened. A structured aggression management plan includes behavioral assessment. Start by observing the dog to identify triggers, e.g., loud noises. Certain people, a professional behaviorist, can help determine the root causes of aggression. Environmental modifications. Modify the dog's environment to reduce exposure to triggers. This can include setting up safe zones where the dog can retreat, desensitization, and counter conditioning. Gradually expose the dog to mild versions of the trigger, rewarding calm behavior to create positive associations. This helps reduce the fear response. Training focus. Incorporate obedience commands and alternative behaviors to redirect the dog's focus from the trigger to the handler. Owner education. Teach owners to recognize signs of fear and stress and avoid reinforcing fearful behaviors, e.g., petting or comforting the dog when it shows aggression. Describe the role of environmental enrichment in reducing anxiety in dogs. Answer: environmental enrichment is critical for managing anxiety in dogs. It provides mental stimulation and prevents the boredom that often leads to anxious behaviors. Key strategies include interactive toys, puzzle feeders, treat dispensing toys, and chew toys keep the dog mentally engaged. This helps prevent destructive behaviors caused by anxiety. Scent work. Dogs have highly developed senses of smell. Scent games like hiding treats around the house can engage their natural instincts and calm them down. Predictable routine. Anxiety can be exacerbated by uncertainty. A consistent feeding and walking schedule helps dogs feel secure. Safe zones. A designated quiet space where the dog can retreat during stressful situations is essential. It should include comfort items like a blanket or bed. Controlled exposure. Gradual desensitization to stressors can be part of enrichment, such as introducing low-level stressors in a controlled way and rewarding calm behavior. Relevant guidelines. The IAABC emphasizes the importance of providing a stimulating environment to manage anxiety in dogs, highlighting enrichment as both a preventive and therapeutic measure. Mrs. Harper has a medium-sized dog, Max, who has bitten a neighbor after being startled. Mrs. Harper is distraught and seeks your guidance. What steps should you recommend to Mrs. Harper to prevent future incidents and rehabilitate Max? Answer: immediate safety measures. Ensure that Max is safely contained in a crate or on a leash, especially when interacting with unfamiliar people or in unpredictable situations. Behavioral assessment. Conduct a thorough behavioral assessment to determine the root cause of the bite, e.g., fear, territorial behavior, pain, desensitization. Use gradual desensitization to help Max get used to people and situations that trigger his aggression. Pair exposure with positive reinforcement. E.g., treats. Training focus. Teach Max alternative behaviors such as sitting or going to mat when he is feeling anxious or threatened. Owner education. Educate Mrs. Harper about recognizing stress signals in Max and how to manage his behavior in stressful situations. Relevant guidelines. The CDC guidelines for dog bite prevention highlight the importance of early intervention, recognizing triggers, and avoiding harsh punishment, which can worsen fear-based aggression. Why is it critical to remain calm and follow structured protocols during an aggressive incident with a dog? Answer: staying calm is crucial to prevent escalating an aggressive incident. Following structured protocols helps ensure safety for both the dog and the handler. Key points include avoiding eye contact. Direct eye contact can be perceived as a threat. Instead, avoid staring, which can trigger defensive aggression. Using neutral body language. Position yourself sideways, keeping a non-threatening posture. This reduces the dog's sense of threat. Clear commands. Use firm but calm vocal commands to direct the dog's attention. Avoid shouting, as this could increase anxiety. Leash control. If possible, use a leash to safely guide the dog away from the incident. The leash provides control while maintaining a safe distance. Retreat if necessary. If the situation becomes too dangerous, slowly back away, avoiding sudden movements that could startle the dog. Relevant guidelines. The Humane Society emphasizes using calm, non-confrontational body language to de-escalate aggression. Structured protocols prevent accidents and minimize stress for the dog. What are some effective strategies for managing a dog's territorial aggression, and how can trainers safely intervene? Answer: territorial aggression occurs when a dog perceives its home or a specific space as a protected area. To manage this type of aggression, the following strategies should be employed: identifying triggers. Understanding what specifically triggers territorial aggression, such as unfamiliar people, animals, or objects, is essential for management. This may involve observing the dog's behavior in different situations. Desensitization and counter-conditioning. Gradually introduce the stimuli that trigger territorial aggression, ensuring the dog is rewarded for calm behavior. For example, start by having a friend approach from a distance and reward the dog for staying calm. Establishing boundaries. Train the dog to associate commands such as leave it or go to your place with boundary setting. This redirects their focus from guarding the space to responding to commands. Using positive reinforcement. Reward calm and appropriate responses to guests or strangers. Avoid reinforcing aggressive behavior through attention, as this can reinforce territorial instincts. Safety protocols. During aggressive incidents, it's important to remain calm. Use neutral body language, and then prevent escalation by removing the dog from the situation safely. How does cognitive decline in aging dogs affect training, and what adjustments should be made? Answer: cognitive decline in aging dogs, commonly referred to as canine cognitive dysfunction syndrome (CDS), can impair memory, learning, and behavior. Adjustments to training methods are necessary to accommodate these changes. Recognizing symptoms. Dogs with cognitive decline may show disorientation, disrupted sleep patterns, or increased anxiety. Trainers should be observant of these signs to tailor the approach accordingly. Simplified training. Dogs with CDS may struggle with new commands or complex tasks. Use short, simple commands and focus on repetition and consistency to reinforce learned behaviors. Incorporating routine. Establishing a predictable routine can help reduce confusion and stress. Keeping feeding, walks, and training sessions at the same times each day helps the dog feel secure. Positive reinforcement. Positive reinforcement remains critical for aging dogs, but trainers should be mindful of the dog's slower learning pace. Rewarding small successes helps keep the dog motivated, avoiding overstimulation. Older dogs may become overwhelmed by complex training sessions. Sessions should be shorter, more frequent, and calm to prevent frustration. Take a scenario where a dog has demonstrated repeated aggressive behavior towards strangers. What steps should a trainer take to assess and address the aggression? Answer: in this scenario, a thorough assessment is crucial before implementing a treatment plan. Here are the steps a trainer should take. Behavioral assessment. Conduct a comprehensive evaluation to identify the underlying cause of aggression, whether it is fear, territoriality, or frustration. This may involve observing the dog in various environments and situations. Health screening. Rule out any medical conditions that might contribute to aggression, such as pain, hearing or vision loss, or neurological disorders. Aggression can sometimes stem from physical discomfort. Trigger identification. Assess what specifically causes the aggression. Is it certain types of strangers, specific body language, or particular locations? Understanding the triggers allows for better targeted intervention. Desensitization and counter-conditioning. Gradual exposure to strangers, rewarding calm behavior and reinforcing positive associations is key to reducing aggression. This process should be slow and controlled to avoid overwhelming the dog. Safety protocols during the training process always prioritize safety. Explain how high-anxiety dogs can be managed using behavioral techniques and how can a trainer minimize the dog's stress during training sessions. Answer: high-anxiety dogs require careful management to minimize stress and improve behavior. Key strategies for managing anxiety include identifying anxiety triggers. The first step is identifying the sources of anxiety, whether they're related to loud noises, separation, or certain types of people. This helps the trainer tailor the approach, creating a safe space. High anxiety dogs often benefit from a designated safe space where they can retreat to relax and regain composure. This space should be quiet, calm, and free from stressors. Desensitization. Gradually expose the dog to anxiety-inducing stimuli in controlled doses, rewarding calm behavior. For example, if a dog is anxious around visitors, start with low-level exposure and work up as the dog becomes more comfortable. Calming techniques. Trainers can use techniques like massage, calming pheromones, or soothing music to help reduce anxiety during training. These techniques should be incorporated before and during sessions to ensure a relaxed state, minimizing stress during training. Sessions should be brief and consistent, avoiding overwhelming the dog. Explain the steps to develop a counter-conditioning and desensitization plan for a dog with severe separation anxiety. What factors would influence the success of this plan? Answer: to address separation anxiety, the trainer should start with a baseline assessment to identify triggers like keys, shoes, or the owner's routine. The next step is environmental management, ensuring a calming environment using tools like pheromone diffusers. For desensitization, the trainer gradually exposes the dog to departure cues at low intensity. Picking up keys but not leaving while rewarding calm behavior. In counter-conditioning, the trainer pairs departure cues with positive experiences, such as treats or toys, helping the dog associate these cues with something enjoyable. Progressive absence training is crucial. Start with brief absences and gradually increase the duration. Success factors include the dog's history with separation anxiety, severity of symptoms, consistency of the training process, and the owner's involvement. Commitment to the plan is critical as consistency in managing departures and rewarding calm behavior is key. Additionally, comorbidity of other behavioral issues such as general anxiety can complicate the process. Trainers must avoid using aversive techniques as they can worsen anxiety, aligning with professional ethics like those from the Certification Council for Professional Dog Trainee. Discuss the ethical implications of using punishment-based methods in training. Reference professional guidelines to justify your stance. Answer: punishment-based training methods, such as physical corrections, shock collars, or verbal scolding, often lead to unintended consequences, including fear, anxiety, and aggression. These methods can damage the dog's trust in its owner and the trainer, creating long-term behavioral problems. Ethical training practices, as emphasized in the CCPDT Code of Ethics, advocate for humane, scientifically backed methods. Positive reinforcement. Rewarding desirable behavior with treats, praise, or toys is more effective in the long term and fosters a trusting bond between dog and trainer. Research published in the Journal of Veterinary Behavior supports this, showing that positive reinforcement results in more reliable behavioral changes compared to punishment, which can escalate aggression or fear. Furthermore, humane treatment guidelines urge trainers to consider the emotional welfare of the dog, ensuring that no harm or distress is caused during training. In contrast, punitive techniques may lead to behavioral suppression, not behavior modification. Trainers are ethically bound to provide education on alternative, non-punitive methods and ensure the welfare of the animals in their care. Neglecting this responsibility may violate the humane training practices integral to professional conduct in the industry. Maria has a dog, Max, who growls and snaps when approached while eating or playing with toys. Maria often yells at Max and tries to grab the items. What should Maria do instead, and how should she modify Max's behavior? Answer: Maria should stop yelling and attempting to grab the items, as this could escalate Max's guarding behavior. Instead, she should take a more gradual and positive approach. First, avoid confrontation by respecting Max's space when he is guarding his food or toys. The next step is to implement trade-up techniques where Maria exchanges the guarded object with a higher value reward, e.g., a special treat that Max finds more appealing. This positive reinforcement method helps Max associate the presence of humans with good things, reducing the instinct to guard. For desensitization, Maria can begin by slowly approaching Max while he is eating or playing, starting from a distance that does not provoke a defensive response. Over time, Maria can decrease the distance and reward Max for calm behavior. Additionally, teaching Max the drop it command can help with controlled exchanges. This process must be slow and patient, respecting Max's comfort zone. Lastly, Maria should avoid punishment as this can increase fear and aggression. By following ethical guidelines like those in the CCP-DT Code of Ethics, Maria will ensure humane, science-based methods, enhancing Max's trust and reducing guarding behavior. Describe the process of identifying and addressing a dog's fear of strangers. Include key considerations for avoiding a counterproductive response. Answer: the first step in addressing a dog's fear of strangers is to identify the fear triggers by observing the dog's behavior in different situations. Common signs of fear include cowering, shaking, barking, or attempting to flee when a stranger approaches. Trainers should conduct a detailed behavior assessment to understand whether the dog's fear is generalized or specific to certain types of people, such as men, children, or people with hats. To address the fear, trainers should begin with controlled exposure by gradually introducing the dog to strangers at a comfortable distance, ensuring the dog remains calm and does not experience overwhelming stress. It's critical to move at the dog's pace, never forcing interactions. Overwhelming the dog by forcing too much exposure too soon can result in heightened fear and even aggression. Trainers should also avoid using aversive methods, as these may further traumatize the dog, reinforcing the fearful response. Key considerations include ensuring that all interactions are slow and positive, respecting the dog's thresholds, and maintaining consistent training using humane methods aligns with ethical guidelines like those of the CCP-DT, which emphasize treating all animals with care and respect. A client offers you a significant financial incentive to prioritize their training needs over others. How should you respond according to professional ethics? Answer: accepting a financial incentive that creates a conflict of interest compromises the fairness and integrity of your professional practice. According to the CCP-DT Code of Ethics, trainers are required to act in the best interests of all clients, ensuring that no one client is favored over another due to personal gain. Accepting such an offer could damage the trainer's professional reputation and erode trust. Trainers must adhere to a code of conduct that promotes equitable treatment and ensures that all clients receive the same level of attention and service. The ethical response in this case would be to politely decline the offer, explaining that your commitment to maintaining a fair, objective, and professional approach requires that all clients are treated equally. It's also important to document the incident in case of future disputes or issues, maintaining transparency. Upholding professional standards and avoiding conflicts of interest is essential for maintaining trust, credibility, and integrity in the dog training profession. By adhering to ethical principles, trainers protect their clients and the profession as a whole. Explain the potential causes of excessive barking and outline a step-by-step plan to address this behavior effectively. Answer: excessive barking can arise from several causes, including attention-seeking, boredom, fear or anxiety, and territorial behavior. Attention-seeking barking occurs when the dog learns that barking results in attention from the owner. Boredom-induced barking is common in under-exercised or mentally unstimulated dogs. Fear-based barking often occurs in response to specific stimuli, such as unfamiliar people or other dogs. Territorial barking happens when the dog perceives an intruder or a threat near its home. To address barking, the trainer should begin by identifying the root cause through observation and owner feedback. If the barking is attention-seeking, the trainer can teach the dog that barking does not result in attention by ignoring the behavior and rewarding silence. For boredom, providing additional mental and physical enrichment is essential. In the case of fear or territorial barking, counter-conditioning can be employed, gradually exposing the dog to the fear trigger at a distance where it remains calm and rewarding calm behavior. Finally, teaching the quiet command can provide a cue for the dog to stop barking when instructed. A holistic approach that identifies the underlying cause of barking and addresses it appropriately using positive reinforcement is key to resolving this issue. Stephen's dog, Bella, lunges and barks aggressively at other dogs during walks. Stephen has tried jerking the leash, but this worsens Bella's behavior. What strategy should Stephen use instead? Answer: Stephen should avoid using the leash jerk as it increases tension and can exacerbate Bella's reactivity. Instead, he should implement positive reinforcement and desensitization techniques. First, Stephen should increase the distance between Bella and other dogs, ensuring she remains below her threshold for reactivity. Gradually, he can decrease the distance while reinforcing calm behavior with high-value treats. He should also teach Bella a look or watch me command so she can focus on him instead of the other dog. Counter-conditioning involves pairing the presence of another dog with something positive, such as a treat or toy, to change Bella's emotional response to the trigger. If necessary, Stephen can use a head halter to better control Bella's head and redirect her attention. Consistency is key. Training should be repeated frequently with patience. Finally, Stephen should avoid punishment as it could increase Bella's stress and reactivity. Positive reinforcement is the most effective and humane approach to resolving leash reactivity. A dog trainer is approached by a client whose dog has severe anxiety. The trainer is not qualified to address mental health issues but feels pressure to help. How should the trainer respond ethically? Answer: the trainer should refer the client to a qualified professional who is equipped to handle severe anxiety issues, such as a veterinary behaviorist or a certified applied animal behaviorist (COB). According to the CCPDT Code of Ethics, trainers are required to recognize the limits of their expertise and refrain from offering services outside their scope of practice. Ethically, the trainer must ensure that the dog's mental health is addressed in the best way possible, which may involve collaboration with professionals in behavioral health, veterinary care, or other specialties. Providing services beyond one's qualifications could lead to ineffective treatment and potentially harm the dog. By referring the client to the appropriate expert, the trainer maintains professional integrity and ensures the dog receives the best care. This also upholds the trainer's ethical obligation to act in the dog's best interest, ensuring no harm comes from improper treatment. What are the primary causes of destructive chewing in dogs, and how can trainers address this behavior using positive reinforcement techniques? Answer: destructive chewing is often the result of boredom, anxiety, teething, or a lack of proper outlets for energy. Dogs may chew on furniture, shoes, or other household items as a way to release pent-up energy or to soothe themselves when anxious. Teething puppies may chew as part of their natural developmental process. To address destructive chewing, trainers should first identify the root cause by observing the dog's behavior. If boredom is the cause, increasing mental stimulation and providing more physical exercise, such as daily walks or play sessions, can significantly reduce the urge to chew destructively. For puppies, providing appropriate chew toys can help redirect their natural chewing instincts. For dogs that chew due to anxiety, counter-conditioning techniques can be useful. This involves pairing the presence of an anxiety trigger with something positive, e.g., treats or toys, to help the dog associate the trigger with positive experiences rather than fear or stress. In all cases, trainers should emphasize positive reinforcement, rewarding the dog for chewing on acceptable items like toys and ignoring or redirecting them away from inappropriate objects. Explain the importance of continuing education and certification maintenance for a professional dog trainer. How does this contribute to ethical practice and high standards in the industry? Answer: continuing education and certification maintenance are crucial components of a dog trainer's professional development. As behavioral science and training methods evolve, staying informed about the latest research and techniques ensures that trainers provide effective evidence-based services. Regularly attending workshops, seminars, and courses allows trainers to expand their knowledge and refine their skills, improving their ability to handle complex behaviors and deliver better results for their clients. Maintaining certification, such as through the Certification Council for Professional Dog Trainer (EE), demonstrates a commitment to ethical practice and adherence to industry standards. Certification ensures that trainers meet the qualifications necessary to use the latest tools and techniques, ensuring that dogs are treated humanely and professionally. Furthermore, certification bodies often require ongoing education to maintain the title, reinforcing the trainer's commitment to professional excellence. Failure to keep up with new knowledge and practices can lead to outdated or ineffective techniques, potentially harming the animals or owners the trainer serves. Explain how understanding a client's learning style can enhance compliance with training plans. Illustrate your answer with an example. Answer: understanding a client's learning style, whether visual, auditory, or kinesthetic, can significantly improve their ability to follow a training plan. For example, visual learners benefit from diagrams, videos, or step-by-step instructions, while auditory learners prefer verbal explanations or podcasts. Kinesthetic learners, on the other hand, learn best through hands-on experience. In practice, if a client struggles with retaining instructions, the trainer should adapt their teaching style. A visual learner might excel if shown a demonstration of a proper sit command, while an auditory learner may require a detailed explanation of how to give the command and when to reward the dog. Kinesthetic learners may need to physically guide the dog through the process. By identifying the client's learning style, trainers can increase the effectiveness of their coaching, fostering better understanding and engagement. This approach ensures that training methods are tailored, promoting long-term success in training. Relevant guideline. The AVSAB stresses the importance of personalizing training to match the learning styles of both owners and dogs, leading to better outcomes and stronger client-trainer relationships. What are 3 subtle behavioral changes that may indicate illness in a dog, and how should a trainer address these observations responsibly? Answer: Subtle behavioral changes in a dog can be early signs of illness and should be closely monitored. These changes include lethargy. A dog that typically enjoys exercise or play but suddenly becomes unusually tired may be unwell. Loss of appetite. A sudden disinterest in food or treats is a key indicator that something is wrong. Increased aggression or irritability. A normally docile dog that starts snapping or acting out can indicate discomfort or illness. Trainers should approach these behaviors with caution, documenting changes in the dog's actions and suggesting the client consult a veterinarian. Trainers should avoid diagnosing the issue themselves, but instead recommend seeking a professional evaluation as soon as possible. Addressing these changes responsibly involves not only recommending medical consultation, but also educating clients about the importance of regular veterinary care and proactive health monitoring. Trainers should be clear that health concerns must be dealt with by licensed professionals, ensuring the well-being of the dog while maintaining their role in the training process. Describe 3 techniques to overcome communication barriers with clients and ensure clarity in conveying training plans. Answer: clear communication is vital to successful dog training. 3 techniques to overcome communication barriers include simplifying language. Avoiding technical jargon and using plain language ensures that clients understand what is being asked. For example, instead of saying positive reinforcement, explain it as rewarding good behavior with treats. Verbal and visual reinforcement. Some clients may struggle with just verbal instructions. Providing visual aids, such as videos or diagrams, can enhance understanding. Feedback loops. Asking clients to summarize what they've learned helps confirm their understanding. It also gives the trainer an opportunity to clarify any confusion. Trainers should adapt to the client's preferred communication style to ensure the message is delivered clearly. This flexibility in communication enhances the client's ability to follow the training plan, leading to better results. Explain why excessive protein in a dog's diet might lead to behavioral issues and how. A trainer can address dietary concerns with a client. Answer: excessive protein in a dog's diet can contribute to behavioral issues like hyperactivity or aggression due to metabolic imbalances. High protein diets may cause dogs to become overly energetic, restless, or irritable, especially in dogs with sensitivities to certain nutrients. Trainers should observe and document any changes in behavior that correlate with dietary shifts. If a dog is particularly excitable or aggressive after a change in diet, it may be worth suggesting a consultation with a veterinary nutritionist. To address the issue, trainers should educate clients about the importance of a balanced diet, emphasizing that not all dogs require high-protein diets. Dogs with specific needs, such as older dogs or those with certain medical conditions, may benefit from low-protein, higher-fiber diets. Trainers should avoid recommending dietary changes but can encourage clients to consult their veterinarian for a tailored plan. Ensuring the dog's diet supports overall health can have a positive impact on their behavior and training outcomes. MS. Carter has a 2-year-old Labrador Retriever, Max, who consistently pulls on the leash during walks. Despite multiple sessions, MS. Carter reports minimal improvement. She expresses frustration and doubts the training methods. What steps should the trainer take to address MS? Carter's concerns and enhance her coaching effectiveness. Answer: the trainer should first assess the training techniques MS Carter is using. It's important to observe if she's consistently applying the leash pulling correction methods, e.g., stopping when the dog pulls, rewarding when the dog walks calmly. If inconsistencies are found, the trainer should offer constructive feedback and demonstrate the correct approach to address MS. Carter's frustration: the trainer should acknowledge her concerns, empathize, and explain that leash pulling is a common issue that requires patience and consistency. Providing MS. Carter with more immediate tools, such as using a front clip harness, can help manage the dog's behavior while reinforcing the correct behavior. Offering a revised, more manageable training plan and setting realistic expectations is crucial. The trainer should also encourage Carter to practice regularly and celebrate small victories. Relevant guideline. The AVSAB emphasizes the importance of setting achievable goals for both the dog and the owner to foster a positive and motivating environment for training. Discuss the potential consequences of inadequate exercise for working breeds and provide recommendations for an urban environment. Answer: inadequate exercise in working breeds can lead to various behavioral problems, such as excessive barking, chewing, and destructive behaviors due to pent-up energy. Additionally, without sufficient physical and mental stimulation, working dogs can develop anxiety or become hyperactive. For urban environments, trainers can recommend a combination of indoor and outdoor activities. Regular, brisk walks can be supplemented with indoor exercise such as fetch. or tug-of-war to keep the dog engaged. Mental stimulation, such as puzzle toys or obedience training, is essential to reduce boredom. Trainers should also encourage clients to seek out dog-friendly spaces like parks or daycare centers where dogs can interact with others and engage in physical activities. Structured activities like agility courses or scent work are also great for stimulating working breeds in urban settings. Relevant guideline. The Association of Professional Dog Trainers recommends providing sufficient exercise and enrichment for working breeds to prevent behavioral issues and promote mental and physical health. How can a trainer manage unrealistic client expectations about immediate results in behavior modification? Answer: managing client expectations requires clear communication about the time and effort needed for behavior modification. Trainers should explain that behavior change is a gradual process and results vary depending on the dog's temperament, consistency of training, and the owner's adherence to the plan. Providing examples of similar cases and how long they took to show improvement helps clients understand that behavior modification is not instantaneous. Trainers should also set small, achievable goals and celebrate progress, even if it's incremental. In addition, trainers can provide regular feedback and updates on the dog's progress, reinforcing that training is an ongoing journey. Keeping the client engaged and motivated while managing their expectations fosters trust and ensures long-term commitment. Relevant guideline. The AVSAB advises trainers to clearly communicate realistic expectations for the time it takes to modify behavior, emphasizing the importance of patience and persistence. What steps should a trainer take if a dog in their care suddenly collapses during a session? Answer: if a dog collapses, the trainer should first assess the dog's breathing and pulse. If the dog is not breathing, immediate CPR should be performed, chest compressions, and mouth-to-snout resuscitation. If the dog is breathing but unresponsive, the trainer should move the dog to a shaded area and check for signs of heat stroke or injury. Trainers should then contact emergency veterinary services immediately. If the dog appears to be overheated, they should try to cool the dog down with water, but avoid forcing it to drink. If unconscious, the trainer should avoid giving the dog food or water until it regains consciousness. Relevant guideline. The Pet First Aid Certification Program provides comprehensive steps for handling canine emergencies, and trainers should be trained in basic first aid techniques to ensure they can respond appropriately to sudden health issues. What strategies can be employed to improve long-term client engagement in the dog training program? Answer: to improve long-term client engagement, trainers can implement strategies such as regular check-ins and progress tracking. Setting short-term milestones helps keep clients motivated. Offering a positive reinforcement-based approach where clients are acknowledged for their efforts increases compliance and satisfaction. Trainers can also make the training process fun and engaging by incorporating the client's goals and lifestyle into the program. For example, if a client is interested in agility or obedience competitions, trainers can tailor exercises to meet these interests, thus increasing the likelihood of continued engagement. Relevant guideline. The International Association of Canine Professionals emphasizes the importance of fostering long-term relationships with clients by keeping the training process interactive and engaging. How does clicker training work, and what are its advantages in shaping dog behavior? Answer: clicker training is a positive reinforcement method that uses a distinct clicker sound to mark desired behavior, followed by a reward, usually a treat. The clicker acts as a conditioned reinforcer, making it clear to the dog which behavior is being rewarded. This precision helps dogs understand which actions lead to rewards. Clicker training is particularly effective because it allows trainers to mark the exact moment of the behavior, providing immediate feedback. This method can be used for a variety of behaviors, from basic commands to complex tricks. The main advantages include increased clarity in communication with the dog, faster learning, and the ability to reinforce small steps in the behavior chain. Relevant guideline. The American Kennel Club highlights clicker training as an effective tool for shaping behavior and recommends it for both novice and experienced trainers due to its accuracy and positive reinforcement approach.